Hey, welcome to Let's Grow Together with Kalyan, Shruti and Richa. ये पॉडकास्ट सीरीज बनाया ही गया है टू लर्न फ्रॉम द इंडस्ट्री एक्सपर्ट्स. ये ट्विटर स्पेस सीरीज को पॉडकास्ट में कन्वर्ट किया गया है सो एवरीथिंग इज रॉ एंड अनफिल्टर्ड. You will hear the audience asking questions to the guest as well. कि ये podcast series is going to be super insightful. So come with an open mind and I promise you बहुत कुछ सीखने मिलेगा. So let's start the podcast in 3, 2, 1. So, in today's space, it's all about breaking myths and understanding women better. And I love spaces like these because these spaces give insane clarity about life. And आज कुछ ऐसा ही इस स्पेस के साथ करेंगे. ये स्पेस में हम uh, सबको basically the space is also a podcast, so I would request everybody to be a little open minded and come with an open mindset कि जो भी होगा जो भी नई चीज़ें सीखने मिलेगी उसको एक्सेप्ट करें. एंड द क्वेश्चंस आर डीप एंड द आंसर्स आर इंसेनली डीप. आई एम अज्यूमिंग दैट. So we have Anjali with us, who is also a doctor, writer, and a wellness enthusiast. So this is one of the spaces जो जिसमें अंजलि आई गेस इज द फर्स्ट टाइम यू आर द host, right? The speaker, basically. So, how are you excited about this space?
Yeah, this is like my first time speaking on a space like this about a cause. Actually, I've been to spaces, but like talking about something that I'm very passionate about. This is something first for me also, and yeah, I'm pretty excited. And let's see where it goes. I would like to have more people and conversation. Like I would like to make it more conversational than just me telling you facts. So let's hope for a good conversation.
Okay, so Richa is also here. So yeah, and yeah, the whole point of this space would be कि इसको जितना conversational रख सकते हैं उतना conversational रखेंगे, and people will keep joining us. So I'll ask the first question to you, Anjali. Uh, let's start with a very basic. What is menstruation, and when does menstruation typically start for a woman? It's a very basic question, but I think we'll start with this one so we get deeper into this kind of a conversation. So yeah.
Hi, can you guys hear me?
Yeah, Richa, we can hear you finally. Yeah, cool. So Richa, the thing is, I asked Anjali about the first question. The question is the what is menstruation and when does a menstruation typically start for a woman? So that's the basic question that we had. First question. So I asked that to Anjali. Yes, Anjali, go for it.
So, okay, so let's get to the topic. Uh, what is menstruation? Actually, it is the most natural and a normal process that a woman goes through in her reproductive age. It's the periodic discharge of blood and tissues from the uterus. And before talking about all the abnormalities of the menstruation, I would like to talk about all the normal things that people may think that it's a problem, but are not actually the problem. So, all the normal things that are related to menstruation, like the start of the menstruation is called menarche, and the end of the menstruation is the menopause. The start typically can happen to a girl anywhere between the age of 10 to 16 years. On an average, 12.5 years is the typical age where a girl might start menstruating. The average length of the cycle is 20 days, as everybody knows, but it can vary up to plus minus 7 days. So a week delay or a week prior to your date, it's absolutely normal. Like don't beat yourself up if it's a few days early or a few days late. So that is completely normal. And the bleeding stage can be up to 3 to 5 days, and it is not very uncommon for minor variations to occur from time to time. And so it's not very like you should not think of it as a abnormality if you have certain small variations in your cycle. And that is typically because menstruation isn't just about the reproductive organs. It starts with your brain. So there are areas in the brain like hypothalamus that releases hormones that are then that they then go to your pituitary gland, which is like the master gland of the body that regulates all the other glands. And then the pituitary gland releases hormone that goes into your ovaries, and then the hormones released by the ovaries go into the uterus, and the whole cycle starts. So if you have any abnormality in your menstrual cycle, it can be because of the brain part, it can be because of the pituitary part, it can be because of the ovarian part, and of course the uterus is one of the thing there also. So it's a very multi organ, multi systemic, and very complex process that people tend to reduce down to just bleeding and mood swings. So it is very complex. The next, so yeah, what the next question, Kalyan?
So the next question was, you basically answered all of it. So, Richa, you want to go next?
Yeah, Dr. Anjali. So, I have this doubt. Being a girl, I am quite aware of it, but then there might be boys who must be curious about it. That what are the typical like first signs of menstruation?
So are you talking about the menarche when the girl is going through her first period, or the start of the cycle on every month?
The first period, and obviously what goes through like every month. You can answer both of them.
So first of all, like the age is a very big factor, and before starting the periods, the females go to uh, a process called thelarche, where the breast buds are they increase in the size, and that is preceded by the start of the periods. So you also have body aches and uh, lower abdominal pains, and because it's the first time in the menarche, a lot of girls do not understand those signs and symptoms, and but then eventually you get used to it, so you know that your cycles are coming, so every 1 or 2 days before the cycle. So those are like this basic uh, signs and symptoms that you can get. And a lot of women also experience mastalgia, which is a pain in your breast, so that is also a sign.
Okay, thank you so much for that answer, Anjali. So the next question that I have is mostly around the myths that we have around this menstruation cycle. Now, I'm going to name all the myths that are there. You try to bust them, okay? So the first myth that I have is women should not exercise during this period. I'm not sure if it is a myth, it's a reality, or it's something that is has to do with science or something. So just try to clarify, should a woman be exercising during a period or not?
There is nothing wrong in exercising, but the thing is, 75% of the females experience some sort of abnormality in terms of pain, duration of the cycle, bleeding, and the amount of blood that they lose. So, menstruation is very different and different for different females. So, if you are having discomfort and if you are going through all those signs and symptoms, and if it is painful, I will suggest that there is a reason why you're getting menstrual leaves, right? So take rest, don't beat yourself up, don't lug yourself too much. If you think your body needs rest, take it, but don't rest or don't stop going or don't stop exercising because you think that you are supposed to do it because something is wrong with you. So it's not about what society or what other people think, it's about you and your comfort. So that is what I would say.
Okay, that answers the question. So the second myth that I have is, it's a very common myth that goes around with menstruation, which is menstruation blood is dirty or impure. So would you like to say something on this?
Yeah. Actually, this myth, it's like it's so deep rooted in the into our culture. It's very, it's of course it's a myth and it is not true, because menstrual blood is as like it's the arterial blood, so it is as pure as blood that goes into your brain. And so there is, that myth is completely wrong. Menstrual blood, you shed the blood because the female is not getting pregnant. The uterus prepares itself every month for pregnancy, and if the female is not getting pregnant, that superficial layer of the uterus gets shed away. So that is just the blood and the tissue that was supposed to be used and utilized for a pregnancy, that is not needed now, is then removed from the body. There's nothing wrong with that blood. It's completely arterial blood. It's not even the venous blood. So that's a myth that everybody should stop believing.
Okay, so what you are trying to say is कि ये blood वैसा ही blood है जो आपकी body में run करता है, तो there is nothing dirty and impure about it, right?
No, it's completely oxygenated blood. Like it's not even an venous blood. So stop like thinking about it as if it's a dirty thing. No, nothing is dirty about that blood.
Okay, cool. So the third myth that I have is it's a myth that I have never heard about, but during my research I figured it out. कि women should avoid bathing or washing their hairs during menstruation. Now I'm not sure if it is true or false. Just give me a clarification on this, Anjali.
It's completely false. That is I no, it's completely false, Kalyan.
Okay, okay. Okay, so the fourth myth that I have is PMS is just a myth. So, so the myth is PMS is just a myth. So, is it something that is there or not? Yeah.
So, as we all have seen all those reels and comedic take on female menstruation and all those jokes on PMS, let me tell you, PMS is as real as a heart attack. So, do not even think for a second that this is a myth. No, it's not. It's a medical condition that a few of the women go through, and it's basically premenstrual syndrome, which is also called premenstrual tension, PMT. It's a complex set of symptoms that the female goes through. It typically starts 7 to 14 days before the cycle. So before 1 or 2 weeks of the cycle, all these symptoms will start happening to the body. And 5% of the women are experiencing it, so it's not a negligible amount. It's not a negligible percentage. So every 5 women out of 100 women are experiencing PMS. And PMS is not just mood, like mood swings. It's not just that. It is a complex problem that comprises of physical, psychological, and behavioral changes. So let me tell you what all those changes are. So it can cause a lot of pain, headache, and abdominal cramps, and muscle stiffness, and full body ache, and back ache. And there is also water retention, so you may be feeling very bloated. At the same time, there is dizziness and faintedness, and there is nausea, vomiting. And the behavioral changes can be depression, feeling of loneliness, low judgment, difficulty in concentration, low performance, anxiety, and it also includes feeling like crying. So, yes, if you feel that way, don't beat yourself up. It's completely normal and it's hormonal. It will go away in a few days. At the end of the cycle, all these symptoms are going to go away. So, all these symptoms, they are going to start 7 to 14 days ago and stop at the end of the cycle. So PMT and PMS is very much also treatable. And it the treatment can go with the, like the basic physical exercise or healthy food, to up to taking a few nutrition, vitamins, to a few medications. And if it doesn't go away, the female may also need surgical interventions, like removal of the uterus and removal of the ovaries. So it's not a joke, it's very much true. And yeah, if not treated, and if not if it's not getting better, you may have to get your ovaries and uterus removed surgically.
Okay. So I have few doubts about it, and I'm going to ask you that. So
Yeah, sure.
अगर किसी period में there's a lot of tension that a woman is going through. So उस particular time पे क्या PMS is a lot more stronger in than the other times? ऐसा कुछ होता है? I'm not sure if the question even makes sense to you or not.
Yeah. Can you repeat the question, Kalyan?
Yeah, so what I want to know is कि क्या PMS gets affected by the stress level, and let's say you somebody is going through a lot of stress एक particular period of time पे, and then she has her periods as well. तो उस particular time पे PMS would be more difficult for her, like there's more PMS. I don't know.
Yeah,
Just
yeah.
just
Yeah, no, no. Your question makes a lot of sense, actually. Stress. Um, um, am I audible?
yes, you are. Yeah,
Oh,
go ahead.
so, what I'm saying is, your question makes a lot of sense, and you will not believe the biological changes stress has in your body. Because stress isn't just like, okay, like I had a bad day. It physically on a molecular level has effect on you. So your tissues have certain neurotransmitters released on them. So like cortisol levels increase in your body, and like stress can be very detrimental. And yes, of course, if somebody is already going through a lot of stress and is now having periods, I am very much sure that they are also going to be having all these symptoms, like exaggerated symptoms. Can be possible, truly possible. I will have to look into it, because good question.
Thank you so much. Thank you so much. And the last and the final myth that this is a funny myth. So it is a myth which is all about कि women who stay together for a long amount of time end up having a synchronized menstruation cycle. Like the menstruation cycle syncs up. Is it? Of course, it's not true. But would you like to say something on this?
Yeah, this is like one of those funniest myths that you come across. Of course not. As in the beginning of the discussion, like some of the listeners are new, I would like to say that menstruation isn't just about your reproductive organs. It's about, like, it starts with your brain. So the hypothalamus, the pituitary glands, the ovaries, and then the uterus comes into play. So it's a multi-organ, very complex process that happens every month in your body. So to think, like, not think about, like, there are so many factors that are internal. There is nothing external that can cause periods. So that's a myth, like a complete myth.
Okay. Licha, you wanna go next?
Yeah. So I have one myth as well. Should we visit temples? I mean, I have a lot of debate around it in my family and in schools, and everyone has a different opinion about it. So, what do you think about it? Should we visit temples?
Um, well, visiting temple is a matter of faith and morals. Whatever opinions I will have about it is going to be very personal to me. So I will not tell somebody else to do what I will do, but I think that visiting temples and like certain areas in your home also, because sometimes women are not allowed to go to the kitchen also and touch the fridge or anything, like those are the things are considered like pure in the house. So since there is nothing impure about the process, which is completely natural, I don't think that this notion of stopping us from going to a sacred place should continue. Like, this is one of those things that we need to stop now, as collectively as a society, not just as women, but like everybody should stop doing that. That's completely my personal opinion, although
My mother would not agree with it, definitely. I don't know. It is just so
mine
hard to
too,
explain
most
to
probably.
previous generation.
Yeah,
Okay,
yeah,
so
that's
I
why
have
I
this,
said it's about.
yeah, exactly. The previous generation, it is just so hard to explain things to them. So I have this next question. Like, are there any specific lifestyle or factors or habits which can affect regularity or intensity of the menstrual cycle? Like, is there something very intense about it? Having a proper lifestyle, it affects, regulates it, or how does it that work?
Yeah, it's a very good question, Richa. Um, I would say that in every chronic, or like it's not just about menstruation, but if you talk about every chronic disease that is so rampant in the society right now, lifestyle changes are the first thing that the doctors want you to do, and those are the most overlooked aspects of the treatment. So, likewise, in menstruation, obesity can be very detrimental. If you are overweight, that has a very bad effect on your cycles, because obesity also leads to PCOS, and that is also one of the topics that we are going to discuss. So I'm not going to talk a lot about it right now. And yeah, like exercise is good. Yeah, meditation has been told to be having very positive effects on the body, and also a very balanced diet. Like dietary intake and having a well balanced diet is very important. Those are like the few things that the doctor is going to tell you every time you visit them for any kind of chronic illness, and those are like the most overlooked things that the patients never ever do that.
Okay. One of the menstruation disorders, I am not sure if I'm allowed to call it a disorder, but there is something called as a polycystic ovary syndrome, PCOS. So, and
Yeah.
or endometriosis, right? I don't even know how to pronounce them, but yeah, endometriosis. Now, what are the common symptoms and available treatment options for these conditions?
Okay, so as I was saying when I was talking about obesity, that there is this syndrome that called PCOS. Actually, the term has been so normalized that it has become a layman term. So PCOS and PCOD are two different things: polycystic ovarian syndrome and polycystic ovarian disease. Poly means many, cysts means cyst, ovarian means ovary, and syndrome. So there are many cysts in your ovary. And then what is a cyst? So a cyst is a hollow space that is covered with a very thin membrane. So think about a balloon, and then think about the ovary, because ovary is an organ, and then there are spaces in the ovary, empty spaces in the ovary. So there are multiple empty spaces in the ovary. That is what is polycystic syndrome, ovarian syndrome. And when you talk about PCOD, it is a combination of all the menstrual abnormalities and hyperandrogenism, which I will explain later. And when all these things combine together, they form polycystic ovarian disease. Now, the thing is, why this problem is very relevant is because the incidence and prevalence of this disease is increasing as the lifestyle, because of the lifestyle changes and the stress level in the society is increasing, like the sedentary life, the diet that people have these days, the not so healthy diet, uh, and the stress levels that are very high in these days, because a lot of women are also working nowadays. So the thing is, there are multiple factors that are responsible for PCOD, and the changes that a female sees in the cycle are they have a very prolonged cycle. They will be menstruating only like in 2 months, or sometimes like even 3 months. The cycles are so long that they don't even go to menstruation for very long time. So polycystic ovarian disease is how it affects the female. What are the implications of the disease? So what happens is, in today's generation, the disease is so common that people do not take it seriously. But as a doctor, I tell all my friends and people from my family to take it very seriously, because you may not be seeing any bad effects right now, but in a long term, PCOD can cause cardiovascular diseases, hypertension, endometrial cancer, and type 2 diabetes. So this is something like a slow poison. PCOS is like a slow poison that will kill you in very long term. So take care of it. Like, do those lifestyle changes. If obesity, like in 50%, more than 50% of the women going through PCOS have obesity. more than 50%. So that's a huge factor that causes PCOS. So one of the things that doctors suggest is weight loss. So even a weight loss of 5% can reduce the symptoms to a very great extent, and that has been documented. uh, Weight loss, and then there is also hormonal treatment, and contraceptives are given as hormonal treatment. And one of the funny things that people do not know is that contraceptive pills have n number of uses. It's not just for stoppage of pregnancy or avoidance of pregnancy. Contraceptive pills are just hormones that are used for so many diseases in the gynecology, and PCOS is one of them. And treatment must be taken. It is a very treatable condition, but at the same time, it is a very neglected condition also. And the second thing is endometriosis. Endometriosis is, if I say in a very simple term, it's the presence of endometrial tissues in parts other than uterus. So those tissues, when the hormonal changes start bleeding. So, for example, you have uterine tissue in your brain, and every cycle your brain starts bleeding. So those tissues will be bleeding every month, and the blood clots will be present in that particular area of the body. So a lot of celebrities like Katrina Kaif had endometriosis, and the only treatment possible, it's like it is one of those diseases that I would never want a person like. Of course, I don't want my patients to be sick, but like it is one of those conditions that you actually feel very sympathetic for the patient, because it is, if it is present in some very bad area, like if it's in your brain, if it's in your thyroid, if it's in your lungs, like it produces its own problem, but it also causes the problems related to that particular organ also, and it can be life threatening. And the only treatment possible is hormone therapy, and it does not have a very good prognosis. So yeah.
Okay. Richa, yeah, go ahead. Richa, are you there? Uh, Richa. Okay, I think Richa का कुछ तो issue आ रहा है. So I'll ask you the question. So Anjali, what do you think are there any foods or drinks that can help with menstruation cramps?
Yes, as I have said earlier, that diet plays a very major role in the health of the patient. There are so many things that you can do apart from that. There are certain food items that you should avoid consuming, like alcohol and caffeine. So no more cold coffees for you. Eating food, healthy food, and limiting foods that are high in sugar and salt and fat. Like avoid those things. And warm baths, shower, drinking warm fluids can help a lot. Warm massages and a few vitamin supplements, and have plenty of rest, enough sleep. Like those are the basic things that people should do. But if you have severe cramps, then they needed to be treated with proper medicines. And there are so many medicines available in the market, and the doctors can prescribe you depending upon how your body responds to it. So yes, apart from that, like the thread that I've shared above, it's there, it's given in that thread. You can do a lot of all these um, things also.
Okay. So, um, what advice or recommendation do you have for young girls who are just starting their menstruation journey? So, any particular specific hygiene practice or self care tips that they should be aware of?
So yes, hygiene plays a very important role in menstrual health, because hygiene can a bad hygiene and can lead to infections, and that then the girl may suffer from pelvic inflammatory diseases that can have a permanent damage to the reproductive tract, and it might lead up to infertility. So hygiene is a very important aspect of menstruation that I would like to tell young girls to think about it. Like the frequency of changing the pads and the kind of sanitary products that are using. Read the directions properly. Those sanitary products, depending upon your liking, should be used in a certain way. And if you are going to, if you're traveling, and if you know that a very hygienic public sanitation is not available, which is like the 90% of the times, like thank God, like to the Indian rail, matlab, road side sanitary sanitation is not very good, and that's like a big issue. And if you are in your menstruation and facing all those problems, so it becomes a problem. And don't avoid changing pads, because it is very like it can cause infection, and that has permanent change damage to the health of the female.
Okay.
Um,
Yeah, Richa, go ahead.
yeah, you can hear me, right? Dr. Anjali, I want to ask this one thing, and this is very personal to me. Knowing that I go through a lot of cramps during my first day and second day, I want you to recommend certain, food or
Rich,
anything, any
Richa,
solution
Richa,
to
Richa.
all the cramps.
Sorry to interrupt you, but I think we did this question. I think आपका network issue कुछ आया ना? So
Oh, I
yeah,
think,
you could
yeah,
not hear that question.
a
Yeah,
lot
you
of
can take the
network
seventh
issues.
one, na? Seventh question you can take. Yeah, the next question.
Yeah. Knowing that there are availability of a lot of products for menstruation, what do you recommend apart from pads and everything?
So, with the advent of a lot of hygiene products and sanitary products into the market, we as healthcare providers do not specifically recommend anything, because it depends upon your choice, your availability, and your affordability. Because a lot of hygiene products may not be affordable for all of the female patients that we have in our clinics. So there are pads, and then there are tampons, and there are menstrual cups. But on the sustainability point of view, I would say menstrual cups, because they are not one time use. So you can use multiple times, and it is environmental friendly, good for the planet. But other than that, it's up to the person, availability of the products and affordability of the products, and also the comfort of the female, whatever they feel comfortable using. And at the same time, the thing with tampons is that the directions that are given on the package should be taken very seriously, because there is this one clinical condition that can happen, which is called TSS, shock syndrome. If you do not change your tampon or remove it timely, it is one of those deadly, life threatening conditions where a female gets infected and have high grade fever, and can even cause death. So yes, depending upon the product you're using, be very sure about all the pros and cons and side effects of the things, and choose as you please. It's up to you.
Okay. Um, and okay. So the next question that I have is around contraceptive pills. So there are. Is it like? Of course, it's a question, and I'm not sure of the everything around it. So is it okay to take contraceptive pills on a regular basis to prevent pregnancy? Also, there are pills in the market that are used to delay periods. So, are these pills safe? What is your take on it?
Well, that's a very relevant question, Kalyan. The thing about the first thing that I would like to tell is that stop taking any medication over the counter. Like, stop going to the pharmacist and ask for the medication. If you have any symptom, like if you want to delay your periods, like go to the gynecologist and ask them. That is one thing. Second, all the contraceptive pills, like, in the Apple products, they have different generations. The oral contraceptive pills also have generations. So every new generation is a bit more efficient, less side effects, and less failure rate. So we are on the fourth generation of oral contraceptive pills, and they have very less side effects and can be used on a regular basis depending upon. And the thing about contraception is that it's a very huge topic. Like, I can't cover it in a 2 minute session, but I'll give it a try. So contraception, depending upon, you need it for a temporary, like for a few years, or if your family is complete and you need a permanent contraception. So that, though there is a permanent sterilization, but if there is, you need contraception for a limited period of time, then there are certain options like oral contraceptive pills and intrauterine devices and intradermal patches and vaginal rings and implants. And depending upon the composition of the hormones, there are still so many types and types of the contraceptions available at the moment. Modern medicine provides a lot of alternatives. So, depending upon your medical history, whether or not the female has any disease or is suffering from any disease from past few years, a lot of changes and recommendations change. Because if you are a nullipera, like if you have never given birth to a baby, and if you are a newly married, and if you need contraception at that period of time, it is going to be different from someone who has given birth and wants a contraception for a few years to space between first and second child. And if you have a complete family, the contraceptive options change. So it totally depends upon the person, and it also depends upon their choice. Like, there are so many options, and depending upon side effects and depending upon the case history, the medical history of the person, contraception can vary. And to answer your question, if they are safe or not, I would say we have come to a point in modern medicine that we do have very safer options. Like, I will not claim it to be 100% best or 100% no side effects, because there is no such thing in modern medicine. There are certain side effects, but those are very minimum. So it's relatively safe and better and has less failure rates. So if you ask me, do I recommend it, or do I give it as do I recommend it to my family members? Yes, I do. So uh, I hope that answers your question.
Since we're talking about contraception and periods together, I have this doubt that most of people have, that can people get pregnant during a period cycle? So I want you to answer this just out of curiosity.
Um, Thank you for the question, Richa. No, you cannot get pregnant during periods. Like, if you are bleeding on those 3 to 5 days, whatever, however long your cycle is, and unprotected intercourse will not lead to pregnancy.
Okay. Uh, so I remember talking to you about this program that the government has, which is Janani Suraksha Yojana. And can you talk about this program and how can it be benefit to pregnant women who aren't financially capable? And also we will talk about Asha workers. So can you talk about the whole program and the agenda behind it?
Yeah, so Kalyan, that's a very good question. Government of India is spending a huge sum of money on pregnant females. Why and how, and of all the questions that I would like to answer, Janani Suraksha Yojana is one of those programs that government runs and is applicable in all the union territories and all the states. Is basically a safe motherhood scheme, and it is an intervention under National Health Mission (NHM) with the objective of reducing and minimizing maternal and neonatal mortality by increasing institutional deliveries among poor pregnant females. Now, why it is so important that that the government is spending so much money is because, yes, we do talk about a lot of advances and development in the country, but if you look at the maternal mortality of India and the West, it is like it we will hang our heads low because the maternal mortality is so bad in our country and it needs to be implemented. So it is one of those reasons, like in certain countries in the West it is one digit and we have three digit deaths. So it is that grave. So what they do in Janani Suraksha Yojana is that they provide incentives. Incentives means money to the poor pregnant female, because of course if you go to a hospital it is going to cost you. So that was one of the reasons why females were avoiding going to the hospital and were getting delivered in the homes. And of course if you are getting deliveries at if you're doing deliveries at home by daimas, and they are not using sanitary hygienic products and sanitary, you know uh, so everything sanitation, and they will not be minding all those things, and that will lead to a lot of health effects to the mother and neonates and leading to the mortality of both of them. And in this scheme what they do is they provide money to the mother and to this one woman which is who's called Asha. Asha is not just a name, it is an acronym for accredited social health activist. So this is one woman. So for example, there's a village and there are pregnant females, a few of the pregnant females, and they will pick one woman who's like at least 12th passed out or 10th passed out, and that woman is called Asha, and then that woman is going to go up to the woman's house and tell them to ask them to register the pregnancy. So that is how it starts. You register the pregnancy and then you get delivered at the hospital, and they also provide the post delivery care to the mother. So what happens is it may not look very important in a non medical perspective, but as a doctor, let me tell you, there are women who are anemic, have some pathology in their reproductive tracts, and when these women go through deliveries and are on the operation table and are undergoing the process of delivering the baby, they die because of it. But if you register the pregnancy and if the woman goes to the hospital before delivery, the doctor is going to make sure that the woman is fit for the delivery. So that reduces mortality, like the number of deaths, exponentially. So at the time of registration, there are certain blood checkups that are done. There are certain examinations that the doctor does, and then yes, of course, the money matters, because in rural, people who are from poor background, if they are getting money for getting their deliveries done at a hospital, of course they are going to do it. So the money can be very less for us people, but like 400, 1400 rupees for a woman for doing a pregnancy in the hospital is not less for them in rural, and it depends upon the rural and the urban population and low performing and high performing states. And the low performing and high performing states are dependent on the maternal mortality and neonatal mortality rates. Sadly, my state comes under low performing state, but states like Kerala are high performing states. So women gets paid 1400 rupees and the Asha gets paid 600 rupees. So that way they get paid a certain amount of money for each and every pregnancy that they get registered and that they get, institutional delivery, for institutional delivery. And the whole scheme has been a very good success in the country. I would say we have reduced maternal mortality, but we have a long way to go. So yes.
Thank you so much, Anjali. If anybody has any question related to menstruation, related to pregnancy, contraceptive pills, and everything, you can go ahead and you can be a speaker and ask Anjali about the same. Uh, we are done with the questions. And Richa, you have anything else to add to this? Or Anjali, do you want to say anything? Any final words that you want to say? Anything that we skipped or missed or something like that?
Uh, No, we pretty much actually covered all the aspects, and like we started with the physiology, the normal things about the normals of the menstruation, and then the abnormals. What I would like to say is talk about it. Like it's not a very there should not be any barrier with communicating about the problems that you have during menstruation. Like take those menstrual leaves. Like a lot of women, a lot of my friends who are doing like working in corporate jobs, having like a very well educated backgrounds, and they shy away from taking those menstrual leaves that are like it's your right, you know. So take it seriously. If you are suffering, don't shy away from asking for it. And if you are a provider, if you're a service provider, if you're a senior, if you're the owner or a CEO, like motivate them to, you know, make an environment where they feel safe to ask for the menstrual leaves, and you know, all those things. So I think like these topics should not be those taboo topics. It's high time that these topics become very normalized. And yeah, like when we started talking about this space, Kalyan, I told you about that one incident that I read in the newspaper where a 12-year-old girl started menstruating, and his and her brother didn't know anything about menstruation, and ended up killing her. So that was a very sad news. Even in the rural population, that should not be the case. So that is what I think, that is what I feel, because mobile is available everywhere, internet is available everywhere. These things should be very normal, very common, and known by everybody.
करेक्ट सो अंजलि व्हाट आई वुड लाइक टू नो इज कि अगर किसी को इस बारे में इतना आइडिया नहीं है ऑल्सो इट हैज़ टू डू अ लॉट विद द सेक्स एजुकेशन एंड आई डोंट नो बट इंडिया में तो सेक्स एजुकेशन इज रियली रियली पुअर सो is there any sources that people can learn from anything that because I'm sure ki adults are not open talking about these stuff and of course the sex education is not that good so how should somebody or someone young understand such thing.
That is the big question, Kalan. Because what the problem is, like, say for example, in my school we were asked to like stay back after the assembly. That used to be very funny, because and then all the girls in the class was like, all the girls in the school were taught about what menstruation is. But now that I look back to it, at the time it felt very like revolutionary to me, but now that I look back to it in a retrospective way, I feel like, why only girls now? Why not all the boys and the girls, and like the whole school? And like, why are you exempting them from attending? Like it's such a normal thing that every woman in their family is going through every month. They have a right to know. It should not be optional. They need to know about it. So that is what I would like to say, that the school administration these days, like I don't know, like maybe they have stopped doing that, and maybe they have started including boys also. But like, when you think of it as a female problem, it remains as a taboo topic. The day you start treating as a very normal phenomenon, as a very natural thing that happens every month, it opens up new conversations, and it opens up like um a place where you feel safe to talk about it. So like for example, it is very sad to know that there are not many platforms that provide the right information. And now that the government has started this new thing where health influencers are like they're sanctioned, and they will be like seen from a lens of the medical perspective, so not a lot of people can be speaking about it. But like there are certain books, children's books, that you can buy and gift to your nieces and the young women in your family. Like, you know, there are books, and you know, some podcasts like spaces like these, and talk about it. Like make an environment in your family where you sit and talk about like all these things. Like sanitary products should not be something that only women go out and buy. Like you can also go out and buy, you know. So I think it starts with you, uh, and with your family and the women in your life. And of course, like having a conversation is the most basic thing that a person should do.
Absolutely, I so agree with you. Richa, any final words that you want to say?
Yeah, the network was so bad. I wanted to listen to that answer of about cramps. I will surely go to the recording and listen to it because I really need it. And thank you so much, Dr. Anjali, for coming to the space. It really means a lot. Answering all the questions so patiently was so wonderful. I actually, मुझे nostalgia हो गया. मुझे मेरी biology class याद आने लगी. I had biology in my 11th and 12th, and I prepared for NEET and all. वो इतना major nostalgia हुआ ना मुझे. But thank you so much. I really
I think
liked the
that
way you answered all the questions.
I think that is something that like stopping all the girls after assembly is something that happens in every school. That they do that, and I don't understand. Like now that an adult, and now that I have all the information that I know now, like if I ever go to my school now, I'm going to go and tell them that stop doing that. You need to include boys also, because after like that meeting now, all the boys in the class will come up to you and ask Ki, what happened, like what were you talking about, and you like as if it was something unnatural or if it was something bad. Girls were not they used to shy away from answering that question.
I agree to
I
that. I
completely
so agree to that. Yeah.
बट मेरे साथ ना
Alright.
रीजन ये था ना कि दैट आई हैड अ गर्ल्स स्कूल तो हमारे यहाँ पे इतने फाउंडेशंस थे नहीं वी वर ऑल लाइक सिस्टर्स एंड वी वर वेरी ओपन टू सच काइंड ऑफ थिंग्स बट देन आई नो फ्रेंड्स हु वर इन कोएड स्कूल्स एंड वो काफी एक टैबू था which I completely agree to it but then I think the society will change and we will bring the change. That's it. Thank you so much, Dr. Anjali, really means a lot.
Yeah, you're
Much
welcome,
Anjali.
Richa. And yes, in COVID school, staining of clothes became a very like once you start having periods and you get stains, like that was one of those very traumatic experiences that all the students, all the female students in my class had to go through, like telling them, and it was such a stigma that it became traumatic. Like you used to check yourself like every other period. So yeah, like things need to change, our man. Like it's high time that we think of it as a very normal thing. Staining is normal. Like don't make it a big deal. If you see someone, go up to them, tell them very politely, and let's make it very normal. Like don't make it an havoc where it is something like it's like the female should not be feeling threatened or like feeling bad about it. Like it should be very normal, like it's high time.
I agree to that. Uh, Thank you so much Anjali for this amazing space and आपने बहुत अच्छे से सारे क्वेश्चंस के आंसर किए and uh, I think we are done with everything that we could think of. And if anybody has any questions, they can reach out to Anjali and also follow her on your on Twitter and LinkedIn. She's super active on both these platforms. So thank you so much, Anjali, for being such amazing guest. And I would like to close this space now and say goodbye to everyone. Thank you so much. Take care, Anjali. Take care, Richa. Bye.
Thank you, Kalyan. Thank you, Richa.
Bye.
Okay. Bye.
Bye bye.
Thank you for listening to us. And if you want to participate in live spaces, just follow our Twitter handles. हम ऐसे spaces हर हफ्ते करते हैं and अगर आपको ये पसंद आया तो follow करना हमको and share this podcast. Thank you so much and see you next week. Bye bye.